Hello, my name is Reagan Bustamante, and today we're going to talk about the healthcare industry. So, a general outline of what we're going to discuss is first an overview of what healthcare administration is, and then we're going to talk about technology and its developments and the ones that are currently being underway. We're going to talk about demographic changes, employment outlook, and tools for learning for future use. So firstly, from the healthcare administration perspective, healthcare administration manages, directs, and coordinates medical services in a variety of settings, from clinics and hospitals to practices operated by groups and physicians. Handling such responsibilities requires a mix of business administration skills and knowledge of medical services and state laws. Professionals must keep up to date on changing federal and state laws governing healthcare. This involves, therefore, maintaining functions and relationships between different layers of an organization, and data collection and analysis skills are very valuable so that we can understand how to create the most efficient and affordable management care for patients. Patient advocates are one of the primary roles the management position fills, actually, because what they're doing is to create a liaison of communication between providers and patients, and to ultimately provide service that is up to date and is as seamless and smooth as can be. The technological developments that are underway is firstly virtual care. Virtual care is how patients can expect an increase in access to, and it's just care through virtual reality, voice, and video. An example of this would be a teledoctor, and those are increasing in popularity. Virtual care will become more needed and expected as for the aging population, and to meet the increasing demands that healthcare will impose onto our society, as our median average age increases. Artificial intelligence is also a key component for technological developments. They can help empower healthcare teams to make better, faster decisions. It, however, is still in its early stages of development, as the healthcare data is kind of not as laid out for a computer to understand, and that's what one of the current tasks the tech world is working on. And once this is underway, it will be able to provide medical professionals and the administrations to make quicker, better, and more accurate decisions about how to proceed forward with patient care in order to maximize the best care and efficiency possible. A key component next is demographic changes. There is an aging population. As the median age of our population rises and the life expectancy increases, baby boomers are now entering into retirement age, and in fact, around 60% of baby boomers have at least one or more chronic diseases. Baby boomers will require more healthcare services than any other generation in America. By 2020, nearly 5.6 million new healthcare jobs will be needed to handle the growth and demand. This means a lot in the health industry, and now we're going to have to start planning out about how we're going to meet these needs and what we're going to do about our already limited amount of nurses and medical professionals in the field. For employment outlook, it's a pretty above average growth rate than most industries, according to the U.S. Labor Bureau. Job outlook is 20% growth in the next 7 years. That's 2.4 million new healthcare workers of all types through 2026. The median pay is almost $100K. That is just going to increase as the demand increases as well for these jobs and services. So if you're looking for a career in this field, it's a very useful one to go in, and there's a lot of need and demand for professional help in this field. Tools for learning. So if you want more information on healthcare industries, there's a great global healthcare outlook report every year created by Deloitte. There's also industry reports and newsletters to help go along in the search further. It's really exciting to see how the healthcare industry is expanding, how it's responding to the demographic changes and the new technological developments, and how the next 20 and plus years it's going to look a lot different than it currently is. And so it's very valuable as a future employee or an employee in general to understand what is going to be the next step in this industry and what is going to be the cutting edge to deliver equitable and affordable patient care and to have systems that interact cohesively. And that's ultimately it. So these are my references, and thank you.